If lab questions make you pause, reread, or second-guess yourself on NCLEX, this lesson is for you. Most students think they fail lab questions because they forgot a normal range. That is not true. They fail because they don't know which labs matter first. Today, you will learn the 3-second lab scan. This is how safe nurses read labs when time matters. Why students struggle with labs. Lab questions feel heavy. There are numbers everywhere. Students feel pressure to interpret everything. That pressure leads to panic. Panic leads to guessing. NCLEX does not reward panic. NCLEX rewards prioritization. How real nurses read labs. In real practice, nurses do not memorize every value. They scan for danger. They ask, is this life-threatening? Is this new? Is this worsening? The 3-second lab scan copies real nursing behavior. What the 3-second lab scan is. The 3-second lab scan is a safety filter. You ask one question. Which lab result could harm this patient first? Not which lab is abnormal. Not which lab is interesting. Which lab changes what you do now? The 3 steps. Let's anchor the method again. Step 1, spot life-threatening labs. Step 2, match the lab to the body system. Step 3, identify the immediate risk. Now let's go deeper into each step. Step 1, life-threatening labs. NCLEX focuses on systems that fail fast. Heart, brain, lungs, kidneys, infection response. Labs connected to these systems deserve attention first. Core red flag labs: potassium, glucose, pH and ABGs, hemoglobin, creatinine and BUN, white blood cells, lactate. If one of these is abnormal, pause immediately. Why these labs matter? Potassium controls the heartbeat. Glucose fuels the brain. pH controls cellular function. Hemoglobin delivers oxygen. Creatinine reflects kidney failure. White blood cells signal infection. Lactate signals poor perfusion. These labs are about survival. Rapid scan practice. Labs appear on the screen. Sodium 139, potassium 6.3, glucose 96. Your eyes should land on potassium immediately. Step 2, match lab to body system. After spotting the lab, do not diagnose. Diagnosis slows you down. Just name the system. Heart, brain, kidneys, oxygenation, immune system. This step keeps your thinking clean. Quick examples. Potassium high. Think cardiac instability. Glucose low. Think neurologic danger. Hemoglobin low. Think impaired oxygen delivery. Creatinine rising. Think renal failure. WBC plus fever. Think infection or sepsis. Step 3, the safety question. Now ask the question NCLEX loves. If I do nothing, what happens first? This question eliminates overthinking. It tells you what matters. Safety question practice. Potassium 6.1. No symptoms yet. If untreated, arrhythmia happens first. That is priority. The red-yellow-green system. Use this mental system. Red means danger now. Yellow means monitor closely. Green means background noise. Red labs. Potassium above 6, glucose below 50, hemoglobin below 7, pH below 7.2, lactate elevated with hypotension. These require action. Yellow labs. Sodium slightly low. Creatinine mildly elevated. WBC mildly high without symptoms. Watch these. Do not panic. Green labs. Stable chronic abnormalities. Normal labs unrelated to symptoms. Ignore these. Labs must match symptoms. NCLEX never tests labs alone. Labs must match the patient. A lab without symptoms is rarely priority. A lab with symptoms changes everything. Example. Glucose is 58. Patient is alert. Versus. Glucose is 58. Patient is confused and diaphoretic. The second patient is the priority. NCLEX lab traps. NCLEX uses traps intentionally. Trap 1, long lab lists. Trap 2, borderline abnormalities. Trap 3, chronic labs without change. Trap 4, numbers that do not match the story. The 3-second scan protects you from traps. Select all that apply thinking with labs. On select all that apply questions, each option must be judged alone. If a lab suggests danger, actions that reduce that danger are correct. If an option ignores the lab, it is wrong. Do not overselect. Select only what improves safety. NGN Case Study Lab Thinking. On NGN, labs are part of a pattern. Labs plus vitals. Labs plus mental status. Labs plus urine output. Patterns tell the story. NGN practice case. Patient is 76. History of chronic kidney disease. Labs show potassium 6.0. Creatinine 3.9. Vital signs show heart rate irregular. This is cardiac risk from hyperkalemia. Priority is safety. Pediatric and OB considerations. In pediatrics, small changes matter more. In pregnancy, normal ranges may shift. Always consider the population. NCLEX expects contextual judgment. Timing rule. The 3-second lab scan should take seconds. If you are staring at labs for minutes, you are doing too much. Clarity creates speed. Final mindset shift. You are not memorizing labs. You are protecting patients. Safe nurses recognize danger early. That is what NCLEX rewards. Final takeaway. Scan for red labs. Match to the system. Ask the safety question. That is the 3-second lab scan. Subscribe to NCLEX Decoded. Comment below, I scan labs with clarity. Let's keep decoding the NCLEX.